It's interesting that when we think about Freud and the fact that he was influential, you must remember that he did this at a time when medicine was ripe for this sort of thing. And what has happened, and this I find very unfortunate, is that as medicine became more laboratory-oriented and indeed discovered some wonderful things, and no question about that, about the turn of the 20th century. And at the same time, there was, and this is why this article says Freud, they insert, is not dead, because at the same time, people were thinking in medicine, that's a lot of malarkey, you can't measure it, it doesn't mean anything, and so on. And there was almost a total switch in the 1950s, starting then, I believe, from some awareness of the importance of unconscious emotions in medicine to a total movement in the opposite direction.
Did we just get sidetracked by the wonderful technologies that were coming out and kind of concentrate on that?
Yeah, to some extent. But I think also it had to do with, one has to think about this culturally too, and medical culturally. Doctors really preferred to deal, and they still do to this day, with something very concrete. Show me the X-ray, show me the MRI, show me the blood tests, and I'll tell you what to do. Don't give me any of this nonsense about the possibility that there's an emotional factor here. There's anecdotal evidence of powerful emotional factors in cancer, in cardiovascular disorders, and certainly in autoimmune disorders, but this is not being studied by laboratory medicine. The NIH is not. They're doing all kinds of studies relating stress to medical disorders. Yes, of course. I was speaking to the doctor just yesterday who wrote the article on hypertension, and he said for years they have been writing articles trying to relate stress in the workplace to development of high blood pressure, and it doesn't happen, because that's really not what high blood pressure is all about. It's about, in a certain proportion, what's going on emotionally inside. In other disorders, it has to do with genetics, and Dr. Mann points out all of these in his article. In other disorders, it has to do with other factors, but in only, he figures, about 20 to 25% is it related to unconscious phenomena.
I guess it comes up, from the question of what you talk about, that the goodest tendencies in people, and I guess their overarching superego or moral values. Is this repression, or are we, would we all be better off if we just admitted that we had a shadow side, where we allowed our child primitive kind of, can you allow your child primitive out to play a little bit without it wrecking your life, I guess, is the question. That may be a little obtuse, but...
Yeah, and in fact, I think that most people listening will not know what you mean when you refer to the child primitive. So I think we have to tell them that there is a leftover child in each of us, and that has no interest whatsoever in becoming an adult, that wants to be taken care of, that really is dependent, and so on. And the interesting thing is that even though we are hundreds of thousands of years down the pike in the evolutionary process, that child primitive still exists, that part of the brain still exists.
It's there in the hypothalamus, right?
Yes, right, exactly. And, of course, the brain anatomically, as you point out, as you can identify a part of the brain where this sort of thing goes on. Now, you brought up the goodist and the perfectionist, and this is very, very interesting, because indeed you have to ask yourself why people have this tendency to expect a great deal of themselves on the one hand, that is in terms of the things they do, and on the other hand to have this need, and this is again expecting something of yourself that you're not even aware of, to be a good person. And I realized in my working with patients over the years how often these two were important factors in people who had the pain problems. Okay, so I asked myself, why? What's wrong with trying to be perfect? What's wrong with trying to be a good person, with being a good person, literally? Why is that a problem? And I concluded that it's because of that leftover child in each of us that doesn't want to. So that is one factor in the development of mind-body disorders. In other words, I think that those pressures that we put on ourselves anger the child primitive. So that is one thing, and it seems to be a fairly substantial one, but it's not the only one. In fact, it's only been the last few years that I've realized the importance of other emotions that may be down there that really are not related to the child primitive, and these take us back to our childhoods. Other painful emotions that generated as we were growing up, and one doesn't have to have been physically abused or anything of that sort. There's what I call subtle abuse. And a perfect example is the fact that men culturally have never felt that they had a role in bringing up children. That was the woman's job. And a man, did his manly thing. He went out and earned bread and so on. And yet it has become apparent that males, boys, have suffered an enormous amount from the lack of a male input into their lives as they were growing up.
The psychotherapy aspects of your program you really kind of give over to the others who are trained in that area. But how does the therapeutic process help, if you can speak of it simply from the outside as an observer, when you send a patient over that you feel that psychotherapy is necessary to help them come to a realization? I guess it's for those people who are unwilling to admit or they don't see.
Let me clarify it for you. First of all, I think it's important to point out that if those people don't know about the mind-body connection, if they don't know about the physical reaction and the role it is playing in this, they can go to the best psychologist in the world and deal with all of the important issues in their lives, and the pain will continue. They have to know the relationship between what's going on psychologically and what's going on physically. Otherwise, they cannot get better. Now, I have a very unique relationship. These are, quote, my psychologists. In other words, they work with me. And when I refer someone for therapy, I don't give them over to the therapist at all. I remain in the picture, not to tell them what to do, but to get reports from them on what is going on.
So that's essential to your treatment.
Absolutely.
Is that report back from the psychotherapist?
Absolutely. And sometimes there are some things that come up that require that I speak to the patient. The therapist will say, he's been saying such and such recently, and I really think he needs to talk to you. He's sort of getting off the track of what this is really all about, psychophysiologically, okay, the connection. Mm-hmm. And so, I do. But it's a very unique relationship.
So they figure they come in to you to treat their back pain, but why the heck fix my mind as well sometimes to get off track? No, not that way?
No, they get off track by perhaps considering some other things, some other explanations for their pain. That's what happens, and they begin to talk about these things, and then the therapist will pick this up and say, well, I think you better call Dr. Sarno and discuss that with him.